Hello guys, in this PowerPoint presentation we are going to learn about the CA esophagus, that is the cancer of esophagus. So the esophagus is basically the pipe which connects the mouth and the stomach. Whatever we eat, it went through the pipe in the rhythmic motion and it is digested in our stomach. So it is a cancer of esophagus we are going to learn. So now we will learn about the types of CA esophagus, its main causes, its symptoms, the risk factors, and how it is diagnosed, and finally the treatment of CA esophagus. So the CA esophagus is the cancer that develops in the esophagus. It begins when the cells in the inner lining of esophagus grow out of control, or there is a formation of mass or the tumor in the inner lining of the esophagus. So now we will focus on the types of CA esophagus. The first one is the squamous cell carcinoma and the second one is the adenocarcinoma. The first one, the squamous cell carcinoma, occurs in the upper and the middle portion of the esophagus. Basically, it occurs in the squamous cells of the esophagus. Now we will move to the second type of the CA esophagus, that is the adenocarcinoma. The adenocarcinoma begins in the mucus secreting glands in the esophagus. It occurs in the lower portion of the esophagus. The third one, that is the others, they are the small cell carcinoma, sarcoma, lymphoma, melanoma, and the choriocarcinoma. These are the types of CA esophagus. So now we will move on to the etiology or the causes of the CA esophagus. The first one is the use of tobacco. The use of chronic use of tobacco can lead to the CA esophagus. The second one is the alcohol use, the use of alcohol. The third one is the history of cancer. If a person is having a cancer or is having a history of cancer in the past, may develop the symptoms of CA esophagus. The fourth one is the old age. The old age people may get the CA esophagus. So the male gender, that is the fifth one. The male gender are more prone to get the CA esophagus than the female. And the last one, that is the Barrett esophagus and the chronic acid reflux. So it is the change in the cells at the lower end of the esophagus that occurs due to the acid reflux, which causes the lining to thicken and inflame. The following are the symptoms of cancer of esophagus, that are the difficulty in swallowing, weight loss without trying, chest pain, pressure, burning sensation, worsening the indigestion or the heartburn, and the coughing, hoarseness. These are some of the symptoms of the CA esophagus. So we will focus on the risk factors of the CA esophagus. The first one is the gastroesophageal reflux. That is this GERD, being obese, smoking, which we have already seen, and the alcoholism, the achalasia. The achalasia is the difficulty in swallowing through the food pipe, that is the esophagus. The further there is not eating enough fruits and vegetables and not having the proper intake of water or the fluids. The last one is the undergoing radiation treatment to the chest and the upper abdomen. Means if the person has already taken a radiation treatment for the chest and the upper abdomen, so he may prone to have the CA esophagus. Now we will focus on how the CA esophagus is diagnosed. The first one is the barium swallow study. In this study, you will have to be kneel by mouth for 8 hours before this procedure. The second one is the endoscopy. In endoscopy, there is a special scope called as endoscope is inserted through the food pipe, and whatever the images are seen on the monitor. The last one is the biopsy. Through the scope, there is the person or who is doing the scopy will take the small part of the tumor which are there in the food pipe. So these are the some diagnosis of the CA esophagus. So now we will focus on the treatment part of the CA esophagus. The first one is the surgery to remove the small tumors. The esophagectomy. Uh, so there is the removal of the small portion of the esophagus. The third one is the esophagogastromy or the esophagogastrectomy. So they will remove the small part or the small portion of the esophagus. The fourth one is the chemotherapy. The chemo drugs are given to the patients through the IV line. The sixth one is the radiation therapy. The radiations are passed. The the seventh one is the targeted drug treatment. The drug treatment uh, is given to the patient, and last one is the immunotherapy. So after all this, the patient may get less immunity. So immune drugs are inserted or it is given to the patient. So these are the PowerPoint presentation of the CA esophagus. Hope you like it. Thanks a lot.